Good day viewers and welcome to our video. And today's vlog and video we will be discussing how to assess neurovascular system and musculoskeletal system assessments. So right here I'm with Don Homao as Junior and I will be assessing his systems. So first what we're going to do, you have to knock the patient's door. So I'm done knocking. So we are now here with the patient. And then provide some privacy. So if there is a drape or a curtain, kindly close it to provide privacy of the patient. Now what I'm going to do, I'm going to discuss the patient's discuss to the patient the assessment that I'll be doing. So sir, this will be musculoskeletal assessment and neurovascular. So I'm going to assess your veins, your cranial nerves, and the rest of your nerves and your hand, your head, your neck. So in the hospital setting, there is a tag here in his wrist that portrays his birth date, his name, and his other details. So when in the hospital setting, you must say, "Sir, what is your name?" Don. Don Humao. So it will also appear here. What is your birth date?
March 3003.
Okay, so it will also appear here in the hospital setting. But since we are in the home setting, we will just do some resourcefulness. So begin in assessing the patient's physical appearance. So are his head okay? Are there any asymmetries? Are there any lesions? The color of the skin and the rest of his body is in good shape. So our patient is well and good. So what we're going to do is we're going to evaluate the patient's orientation. So sir, what time is it now? It's like at noon time or afternoon time?
Afternoon.
Okay, so where is your place located? Or like where are you in now?
Bugo City.
Okay, so the patient's orientation is well and good. So what I'm going to do now, I'm going to ask him about his past memory if he still remembers something. So sir, where did you graduate in your junior high school?
In the city of Bugo Science and Arts Academy.
Okay, so his memory is still fresh. So when is your baptismal anniversary?
May 21.
Okay, so what we're going to do, we're also try to establish orientations from written something. So what is your experience on this word? So this one. What is your experience on this one?
It is a bike.
Any experiences?
Yeah, I rode a bike with Trek as a brand new bike.
Okay, so our patient is recalling past memories and really portraying good memories in his life in trekking. So now we are going to have tests for his cranial nerves, which is 12 stages or 12 types. Now we're going to the first stage. So I'm going to ask the patient to close his eyes, and then I'm going to cover his one nostril, and then sir, kindly smell this one. So what is that smell, sir?
Tea.
Okay, so tea, it is correct. So the cup, the liquid that is in the cup is a tea, and the patient smelling is good. And then the other mug is the other liquid. So sir, close your eyes. Then let's try his other nostril. So kindly smell this one. So sir, unsa man to yung nasimutan?
Calamansi juice.
Okay, so the patient is correct also because this is calamansi juice. So the next stage of cranial nerves, we are going to assess his papillary constriction and his visual acuity. So what we're going to now, we have to have a Snellen chart, but since we don't have it, we are just using some random things And then our patient here, we're going to read it. So it's approximately 20 feet away. So sir, kindly read the letters.
Kids Club.
Letters.
KIDSCLUB.
Okay, so the the patient's eyes are well and good, but what we're going to do now is we are going to cover his left eye. So we're going to assess his right eye. So sir, kindly read,
Kids Club.
and then the letters,
KIDSCLUB.
and then the other one. So kindly cover your right eye and then your left eye.
Kids Club.
Okay, and then
Kids Club.
the letters.
KIDSCLUB.
So the patient's eyes are in good shape or in good acuity. So it's 20/20, his left and right eye. So I have no problem about that. So inspect if the patient can see his above and below his peripheral views. So what I'm going to instruct you, sir, to cover your right eye, your left eye, right eye. And then, so look into my eyes, sir, directly look into my eyes, and then I'm going to give numbers here. So what is the number here?
3,
Okay, so this one.
4,
And then the left eye, please cover it. So how about this one?
1,
And this one?
5.
So, okay. The patient's eyes is well and good. So next is we are going to do the pupillary constrictions. So we dimmed the light and let us ask the patient to focus this figure, sir. And then I'm going to have the pen light, but since we have no pen light, we're just using flashlight from the cell phones, and we're trying to get his pupillary constriction or pupil constrictions. So as you can see, it is really constricted. The next one, and it is constricted also. So the patient's eyes well and good. Follow this, sir. So, sir, kindly look here and then follow this one. I'm going to let this thing go near into your eyes. So the next cranial nerve we're going to assess. So, sir, kindly smile and then frown and then wrinkled forehead, and then puffed cheeks. So the patient's cranial nerve here is very good and very spontaneous and is well and good. Going to have the next cranial nerve here. So the auditory, going to check his hearing. So I'll be covering his ear and then I will whisper a word or a phrase and then he will re-say it. So say it, sir.
Neurologic microscopy.
Then the other one. Silicovolcanoconiosis.
Silicovolcanoconiosis.
So the patient's hearing is well and good. So now we are going to cranial nerve into his mouth. So what I'm going to do is I'm going to check his gag reflex. So sir, it may be uncomfortable. Is it okay with you?
Yes.
Okay. I'm going to ask the patient to open his mouth, and then I'm going to touch his posterior pharynx. Open pa dyan, sir. So his gag reflex is well and good. So I place my hand on the patient's shoulders while he or she shrugs against the resistance. So, sir? Okay, so it is well and good. And then, then place my hand on the patient's left cheek and the right cheek, and have the patient's puff or push my hand. So puff, sir, or push, Pachad. Okay. So his cranial nerves are well and good. So what they're going to do, you should inspect the ability of the patient to move his neck. Kindly move your neck, sir. Okay. And then please touch your chin. And then your chest. Then to each shoulder using your two hands. And then put your hands on your ear to the corresponding shoulder. And then tip head back as far as possible. Head back, good sir. Okay, so the patient's flexibility and cranial nerves are well and good. So now I'll be inspecting his upper extremities for any lesions, any rashes, or any lumps. So his skin color also. So the patient is having skin asthma or atopic dermatitis in his early childhood stage, but it is now scars, so we are now well and good here, so there are no lumps. So, sir, okay, and then so it is well and good. So ask the patient to extend arms forward, sir, and then rapidly turn scalp up and down. Okay, so the patient is good. And then I must ask the patient to flex upper arm. Left side, sir. And then I will be resisting the opposing force. So our patient is very strong. So then we must check his hands. So palpate if are there any lesions or lumps or cysts or any fungal infections. So our patient's hands is good, and then we must locate also his radial arteries, his wrist. So our patient is well and alive, and then his brachial arteries. So it is also palpating, so the patient is well and good. And also make sure that his hands or his fingers are well and good. There are no clubbing, no jaundice or any cyanosis. So it's okay. So also check any deformities, any asymmetries, and then it is good. And then his elbow, so okay. Okay. So now I'm also asking the patient to squeeze my hand to assess his strength and his force. So sir, kindly give more, sir. Okay, so I'm going to ask the patient to close his eyes, and then I will place a familiar object in his hand and ask him to identify this one. Sir, unsa na siya, sir?
Comb.
Okay, so how about this one?
Another comb.
Okay, so the patient's ability to distinguish is good. So right now I'm going to ask the patient's palm. And then sir, I'm going to write, please close your eyes. Then I'm going to write a number, and then please say what is the number that I have written.
1. 10.
Okay. So the other palm.
4. 21.
Okay. So good. So right now, I am going to have the patient in Fowler's position because we cannot provide supine position. And now we are going to check any lesions, any the lower extremities, the legs, the feet, color of the feet, the lesion, varicosities, hair growth, nail growth, edema, and muscle mass. So his hair growth is well and good. It is in equilibrium. It is good. And then the shape of his legs. So as you can see, we have atopic dermatitis here since our patient was suffering from it, but now it is good. And then we're also to check his nails. So as you can see, his nail here is having some asymmetries. It's because our patient here is good in basketball. He is the MVP of some varsity in his school, and he is really practicing well. And then because of that, our patient is suffering from asymmetries or bad shaped nail because of the game. And also we are going to check the color. So it is fair. And then the edema and the muscle mass. So when checking the edema, we are going to let's test for pitting edema in the vertebral area by pressing the fingers into the skin. So after the fingers have been lifted, and then we are going to see if there's. So the patient has no edema because the skin goes back again. So I'm going also to check the temperature of the legs, so it's good, and the pulse of it, so it's good. And then next we are going to have a straight leg test. So one at a time. So sir, kindly straighten your legs one at a time, and then the other one. And then sir, then straight to just okay. So I'm asking the patient to raise the thigh against the resistance of my hands. So sir, kindly raise your. Okay. Balik sir. And then pull. Okay. So the next one. So what we're going to do now, we have to have tendon reflexes. So we are going to locate this one, his wrist, his radial, and then his antecubital, his triceps, and then his tendon Achilles, and then his antecubital. So unfortunately, here in the province, we cannot provide a real flex hammer or hammer reflex. So we are just going to be resourceful. We don't have also mortar and pestle, and the hammer is very dangerous. So we're going to have this hard portion of the comb. So we're going to just to try this one. And then I'm going to put my fingers here. Then I try to go this way. So this is just a portrayal or to show the proper way, but it is not really accurate. And then we are going to have the antecubital area. I'm going to put my fingers here. I'm going to tap this one. That is how to reflexes on your antecubital. And then second, we also have to check his tendon, his tricep tendons. Then his patella. Now done to his left side of the body. Now we're going to the right side of the body. So first here. And then this one. And then and then this one. And then his Achilles tendon. So we are now done with our tendon reflexes. So now I'm going to stroke the sole of the patient's foot with the end of a reflex hammer handle.
Ito bro.
And then I will ask the patient to dorsiflex and then plantarflex both feet against the opposing resistance. So next one. Okay, sir.
The color.
So we need to have the patient in a standing position and observe the patient as he walks with a regular gait on the toes and then the heels. So toes first, sir, and then the heels. Toes first, then heels. Okay. And then we will ask the patient to walk heel to toe. 1, 2, 3, go, sir. Heel to toe. Okay. We're going now to perform the Romberg's test. Ask the patient to stand straight with feet together. And then both eyes closed. Please close your eyes. And then with arms at side. Just like this one. And then please weigh your hands and maintain balance. So the nurse must be the nurse must be alert so that maybe the patient will fall. Okay, so 20 seconds now is over. And that ends our neurovascular and musculoskeletal assessment with Mr. Don Huao. So thank you for watching, viewers, and then like, share, and subscribe to our YouTube channel.